my first patient, I chose Ben Johnson. He has type 1 diabetes mellitus with ketoacidosis without a coma. Now, when looking over his file as well as his chart and the notes that were put in by the practitioners, I noticed that he has a consumption of a very high sugar diet. He also consumes a lot of fast food. Now, with his diagnosis of type 1 diabetes, that's a big deal. When looking at the simple carbs that he's consuming, it can often cause that blood sugar to shoot up, which of course is what we are noticing in his charts and his levels, that he does have that high blood sugar. He also, in regards to just the history of the time frame before he actually came in due to just the experience that he was having, he was begging for soda after having already had an entire liter in the morning and then wanting the rest in the evening. That just shows that with diabetic patients, a lot of times they are craving that sugar, that soda, because of their blood sugar levels. So their body is looking for an easy way to consume that, and oftentimes that is where they lean towards that soda. So that was something that stood out for me just in regards to him as a patient and what he is currently going through. And so then continuing and looking at just the pharmaceuticals that are prescribed to him, of course, his insulin injections as well as his dextrose. Now, when we're looking at those, we're obviously looking at where he's at in regards to his journey as a diabetic patient. One, not knowing that he was, but also not really understanding what is happening with his body. And I think, yes, while insulin is going to be important for him as a diabetic patient, it's also important for him to understand why. And it's important for him to understand what we're doing and what we're giving to him. So while I don't have any negative response in regards to that, I do think that we need to monitor and be able to address his blood sugar and his insulin levels through dietary changes. And that's something that I would want to sit down with him and discuss, to make sure that we were giving him the option to also be able to monitor and create kind of a plan for him where he can still do that without consistent dextrose and insulin. Of course, again, he is a type 1 diabetic patient, so it is important for those insulin levels to be where they need to be, but there are definitely absolutely ways for us to be able to monitor and for him to be able to make sure that he is checking his blood sugar levels and adapting them with diet changes. Now, patient did come in with a chief complaint of fatigue, polyuria, nausea and vomiting, polydipsia, decreased appetite, as well as abdominal pain. He was also taking shallow labored breaths with an irregular rate, and that is something that by looking at that, we want to make sure that we are educating him once again on the effects of having type 1 diabetes and not being able to monitor and take care of that himself, as well as the fact that it led to the ketoacidosis that he was experiencing. Now, he did report that he thinks that his mother takes pills for sugar. From just my understanding, I do believe that that also meant that there might be some form of diabetes within his family history, and that was something that I would like to sit down and discuss with him further, just to have a better understanding. Of course, he may not fully comprehend or understand, but it is important for us to be able to kind of get a hold of that family history a little bit more so. He also uses alcohol daily, smokes marijuana frequently, and occasionally uses street drugs. He also binge drinks regularly. A lot of alcohol, depending on what he is consuming, has high sugar content. And so not only is he begging for soda, but he also consistently drinks potential high sugar content beverages, as well as things that might contain those simple carbs that we were discussing that can cause that blood sugar to shoot up. So those are things I would also want to address with him. Based on just reading his overall chart, he's very unaware of his general well-being, and those are things that are super important to educate. A big part of why I want to do what I want to do is because I want him to understand, and I want patients to understand and educate and have them have the knowledge to know what's going on so they can make the best and most educated decision for themselves. And so that is something that was very clear in Ben's chart, that he is not understanding and he is very unaware of his general well-being, and a lot of the things that maybe most people would have seen as signs or symptoms of a red flag of what's going on within his life. It sounds like he really didn't until it was almost, in a lack of a better word, too late. Now, based on the information that was provided in the 24-hour recall and his BMI, it was recommended to refer him to an RDN based on the RN's demonstration, just regarding his weight loss and his recovery. Now, in my eyes, this is weight bias because we are basing his recommendation to lose weight on a 24-hour recall of his diet as well as his BMI. There are a lot of factors that come into the BMI itself. So while just the general weight and height do put him in that overweight area, it does not necessarily mean that he is unhealthy in regards to his weight itself. There are a lot of other factors that come into play, and that's why it's important to understand him as a patient and understand what's actually going on. And so that is something that I would first address with the RN to let them know that I would like to do further research before recommending that he lose weight, because it might not be a weight loss concern. He could be someone that is very active that we don't necessarily know in regards to just picking up weights. He might have a higher muscle mass percentage that pushes his BMI to the weight that it's at. Now, I would first address this, of course, by sitting down with Ben and having those conversations with him to really get to know him as an individual, to get to know his lifestyle, get to know what shifted, get to know a lot of things about him, and just in regards to his lifestyle and the choices that he's made up until this point, but also getting to maybe an emotional side. There's obviously reasons as to why he is drinking on a regular basis, why he is consuming other drugs or the use of marijuana. Now, it's important to understand that because in order for us to make the best decision in regards to what plan we want to put him towards, it's important to understand all these other pieces to create a whole image of what we need and what we see for him. In regards to getting to know him as a person and understanding the type of diet change that we want him to have occur, but also for him to choose that. Based on the fact that he is very unaware of his overall well-being, it's important that we sit down and talk to him and educate him so that way he understands what can happen if he continues down this path, but also again for him to be able to feel like he has that empowerment to make those decisions himself, and understanding where he's at on his end to then be able to make the best educated and well-known decision for himself, which I think will only show that he will end up having a better plan and process and a more successful one by allowing him to understand that and overall his health as well as his concerns, so he can make those best goals for himself.